According to the American Heart Association, it's estimated that more than 95% of cardiac arrest victims die before reaching the hospital. Would you know what to do in an emergency situation? In this video, you'll learn the warning signs of heart trouble and what to do in case of emergency.
Sir, can you hear me?
While you'll be learning the techniques of cardiopulmonary resuscitation and a new technique called cardiocerebral resuscitation, you will need to take a class in order to become certified. A heart attack, while potentially life-threatening, usually offers a short period of time in which treatment can save a person's life. Heart attacks are most often caused by a blockage in the heart. As the heart muscle weakens, the victim becomes short of breath and eventually loses consciousness.
Our bodies have approximately 10 minutes of oxygenated blood. What happens is, if nothing is happening and the heart is not pumping, the blood starts to settle.
The warning signs of a heart attack are chest pain that lasts for more than a minute or comes and goes, pain in the upper body, stomach, or arms, shortness of breath, and lightheadedness. Victims may also feel nauseous and break into a cold sweat. Cardiac arrest refers to a sudden, profound disturbance in the heart's electrical rhythm that causes the heart to stop beating abruptly. Cardiac arrest must be treated immediately to avoid sudden cardiac death. Whether it's a heart attack or another reason a person is down and non-responsive, how quickly you react in an emergency situation is critical to saving that person's life. Cardiopulmonary resuscitation, or CPR, should be used to help restore proper breathing. If you did not witness the person going down, err on the side of cardiopulmonary resuscitation.
A near drowning, a lightning, a drug overdose, choking, these kinds of situations, because the body is really absorbing oxygen very, very quickly, okay? Because the brain is telling it needs oxygen, so it's really sucking it up real quick. So in those cases, yeah, we definitely want to be in a situation to where we use CPR.
If you actually witness an adult collapse, cardiocerebral resuscitation should be used to keep blood and oxygen flowing to the heart and brain.
This is for adults. It's not for kids or children, okay? We want CCR for adults, and it's an adult witnessed arrest outside the hospital environment.
Because the brain is the first organ affected when the heart stops beating, it's important to get blood flow and oxygen to the brain as quickly as possible. Using cardiocerebral resuscitation is the best technique to avoid brain damage and death.
It's cardiac cerebral resuscitation, and what we're trying to do is circulate blood from the heart to the head.
Unfortunately, there are no warning signs for cardiac arrest. Should you be in a situation where you see a person suddenly fall to the ground, cardiocerebral resuscitation, or CCR, should be used. If sudden cardiac arrest lasts more than 10 minutes, the survival rate is less than 5%. If you see a person collapse, first, gently shake them to see if they can be revived, then call for medical help.
You call 911.
If that doesn't work, position the victim on their back, remove clothing to expose the chest for proper hand placement, and then immediately start rapid, forceful chest compressions. The technique is the same as CPR minus the rescue breathing. To begin, put the heel of one hand on the center of the person's chest between the nipples. Place the other hand on top and lace the fingers together. Straighten your arm, lock your elbow, and center your shoulders directly over your hands. Using your body weight, press down on the chest. Compress the chest down about 1.5 to 2 inches and give 2 compressions per second. Continue to push down hard and fast on the chest, 100 times per minute. Don't stop pushing on the chest until emergency responders arrive. The American Heart Association recommends giving 100 chest compressions per minute to maintain normal heart rhythm and oxygen flow. Here's an example.
Press 1, press 2, press 3, press 4, press 5.
Since cardiac arrest is rare in children younger than 8 years of age, err on the side of caution. If a child collapses, assume it is respiratory arrest and give traditional CPR. Again, CPR is used to restore proper breathing in an individual who is stopped or is having trouble breathing. For children 1 year of age through puberty, the techniques are similar, yet slightly different. First, move or remove all clothing covering the child's chest. You need to be able to see the chest move. Use only the heel of one hand to give compressions. If you need more force for a larger child, use both hands as you would for an adult. Continue to give 30 compressions at 100 beats per minute, followed by 2 breaths until medical help arrives. For adults, the procedure is the same, except you use 2 hands to compress the chest. Another option is to use an automated external defibrillator, or AED device. These are usually found in public places in a highly visible area. As soon as the AED is located, open it and follow the detailed instructions for use. Be sure to follow the initial steps for CPR before using the device, such as calling for help and trying to revive the person. Then follow the voiced instructions in the AED device.
Apply pads to patient's bare chest. Analyzing heart rhythm. Shock advised. Charging. Deliver shock now. Press the orange button now. Shock delivered.
Once the instruction stops, begin traditional CPR until first responders arrive. Remember, this video is only a demonstration of the techniques. If you are interested in becoming qualified to perform CPR or CCR, you will need to take a class with a certified instructor. If you'd like more information about these life-saving techniques, log on to the American Heart Association's website or sign up for a CPR or CCR certification class.